This is part 3 of the lecture notes on the skeletal system, part 1. There we go. Okay, we left off on this slide, so I'll just review with you. What bones need in order to grow are the minerals, calcium, and phosphate, calcium salts, in other words. And these are absorbed from the mother's bloodstream during prenatal development. In fact, the mother also often has low calcium levels because the baby competes for the calcium. Vitamin D3 is necessary for calcium absorption. There is a hormone called calcitriol that vitamin D is like the precursor of calcitriol. So the liver and the kidney process vitamin D3 into calcitriol. And calcitriol stimulates calcium and phosphate absorption. Into the bloodstream, okay? So absorption into the bloodstream will raise your blood calcium levels and allow your osteoblast to produce more. The calcitriol will stimulate calcium absorption into the blood, and that will raise your blood calcium levels. And then the vitamin D3 is manufactured by epidermal cells or skin cells that are exposed to ultraviolet light. So we do need a little bit of sunlight for that reason. And you can obtain vitamin D3 from dietary supplements and dairy products. When you have a deficiency in vitamin D3, the bones can become soft, and that is called osteomalacia in adults and rickets in children. So rickets is when children have a vitamin D3 deficiency. Now, vitamin A and vitamin C are also important. They provide support for the osteoblast to produce more bone tissue. And then there's some hormones that affect bone growth, and that would be a hormone just called growth hormone, thyroid hormones, sex hormones like testosterone and estrogen, and then calcium balancing hormones like parathyroid and calcitonin. Now I was going to see if it told about that. Okay, so calcium balancing hormones, parathyroid hormone it kind of works along with calcitriol in allowing your blood to absorb more calcium absorbed into your blood. So parathyroid hormone raises blood calcium levels, and calcitonin, which is produced by the thyroid gland, lowers blood calcium levels. So parathyroid hormone produced by the parathyroid glands raises calcium levels, calcitonin lowers calcium levels. All right, I'm just going to skip that. Remodeling happens throughout our lives. Our bones are not just, they don't just stop changing. They grow and change throughout our lives, not in size, but bone tissue is recycled, kind of like skin cells are shed and then they are replaced with more skin cells from the stratum basale. The remodeling process of bone takes a longer time. It's not like a 3-week period like we talked about with skin. But basically, if our blood calcium levels are low, the best place for our body to obtain calcium is to break down bone tissue. And if our blood calcium levels are high, the best thing our body can do is to take that calcium and produce new bone tissue with it, so it would lower the blood calcium levels. So what happens in remodeling is that the osteocytes maintain the bone matrix. The osteoclast remove matrix, and the osteoblast build matrix. And normally the activity of the osteoclast and osteoblast is balanced in a full-grown adult. And like I was saying, the reason for bone remodeling is that, well, one is turnover of minerals gives bone the ability to adapt to new stresses. Um, Heavily stressed bones are thicker and stronger, so exercise, weight-bearing exercise, walking, and just any weight-bearing exercise will help to make your bones stronger and thicker. And bones that don't receive a lot of stress on them from exercise are thinner and more brittle. That's why women who get osteoporosis or who are at risk for osteoporosis older in life, at an older age, they'll have them do weight training, but it's low weights. It's not trying to not trying to build huge muscles, but just using very low light weights, and that will help their bones from becoming brittle. So anytime somebody's inactive, like if they have to be on bed rest or they're on crutches, they can lose bone mass. And pregnant women lose bone mass. It says in young adults, nearly 1/5 of the skeleton is recycled and replaced each year. So it takes 5 years in young adults to replace the entire skeleton. And spongy bone is remodeled at a faster rate than compact bone. That's because it's the first bone to form. And it's faster because it's got the air spaces. Now, I already talked about this, so I'm just gonna, the role of calcium. Okay, our levels of calcium in our blood are real important. They are important for neuron or nerve impulses, and they are important for muscle cell contractions. So we need a certain level of calcium in our blood, but if it's too high or too low, it can lead to really serious problems. So 99% of the calcium in our body is deposited into the skeleton. It's used to make bone tissue. But to maintain the level of calcium ions in the blood, these hormones are used. Parathyroid hormone and calcitriol raise blood calcium levels, and calcitonin lowers blood calcium levels. So those are always at work keeping homeostasis, maintaining homeostasis, negative feedback. All right, osteopenia is inadequate ossification that happens due to aging. It is related to estrogen and testosterone levels. When these levels drop, and women lose about 8% of their skeletal mass each decade, and men lose about 3% each decade. In women, it accelerates after menopause because of the loss of estrogen, and that is the reason some women will go on estrogen therapy when they begin menopause. And osteoporosis is a more severe form of osteopenia, and it's more likely if you have osteoporosis that your bones are more brittle and they're more likely to break. And why is osteoporosis more common in older women than older men? And that's because of the declining estrogen levels. That happens due to menopause. Bone markings. So features of the bone markings on the bone can be where tendons and ligaments attach to the bone, or where the bones where the bones articulate with other bones at a joint. There are elevations, processes, or projections. These would be structures that kind of stick out from the bone. And there are also depressions, grooves, and openings where like blood vessels and nerves can pass through. And we'll talk about some of these. You don't have to learn all of them. Now, just a real brief, because we're going to talk about the axial skeleton next, but we need to just do a little overview of the entire skeletal system. So there are 206 bones in the skeletal system, and the skeletal system is divided into the axial skeleton, which we will cover in this unit, and the appendicular skeleton, which we will cover in the next unit. The axial skeleton contains the skull, the rib cage, and the spinal column, the vertebrae. The appendicular skeleton is the appendages, which means the upper and lower limbs, arms and legs, and the pectoral and pelvic girdles. Remember, the pelvic girdles is your pelvic bones, the ilium, the ischium, and the pubic bone, and then the pectoral girdle is formed by the collarbone and the shoulder blade. Let me say the anatomy words, I'm sorry, by the scapula and the clavicle. And this is a figure of the entire skeleton labeled with the major bones. It's really hard to see, and I know if I don't think I can blow it up, or I can do like this. There we go. It's a little better. I can't write on it, but I can tell you, starting at the top left, just looking at the axial skeleton, the skull is divided into the cranium and the face, the facial bones, the cranial bones and the facial bones. The cranial bones form the part that protects the brain, and then the facial bones are, located in your face. Then there are auditory ossicles that are in your ears, and there's the hyoid bone that's in your neck region. There's the sternum, which is your breastbone, and the ribs that together form the rib cage. And then there's the vertebrae, the cervical vertebrae in the neck, the thoracic vertebrae in the chest region, and the lumbar vertebrae in the lower back. And then, of course, you have the sacrum and the coccyx. Now, the other bones of the appendicular skeleton, we start off with the collarbone is the clavicle and the shoulder blade is the scapula. They form the pectoral girdles. And then the humerus is the upper arm bone, and then you have the radius and the ulna. To remember where they're located, the radius will always be on the same side as the thumb. The carpal bones are the wrist bones. Then we have the metacarpals and the phalanges. There's the proximal, middle, and distal phalanges. The distal phalanges are at your fingertips. Then you have the hip bones, which form the pelvic girdle. We learned those, the ilium, the ischium, and the pubis. And then we have, sorry, I was interrupted. So the hip bones, remember, the ilium, the ischium, and the pubic bone. And we'll talk more about those later on in the chapter, or actually in the next unit. The femur is the thigh bone, the patella is the kneecap, the tibia is the thickest bone in the lower leg, and it does connect with the femur. So the tibia is your shin bone, and the fibula is the tiny, like little skinny, delicate bone that is lateral, on the lateral side of your tibia. So you've got the tibia and the fibula that form the lower leg. The larger of the two is the tibia. The tarsal bones are the ankle bones, and then there's metatarsal bones, which form your foot, top of your foot, and the phalanges, of course, form your toes. I'm trying to make this smaller, and it's not working. There we go. Must have been doing something wrong. Okay, so the axial skeleton, this is the rest of our chapter will be on the axial skeleton. The axial skeleton forms the longitudinal axis of the body. It contains 80 bones, which include the skull bones, and that's 8 cranial bones and 14 facial bones. And then there are 6 ossicles found in the ear, and the hyoid bone is found in the neck region. And there's bones of the thoracic cage, the ribs, and the breastbone. And then there's the vertebral column, which contains 26 bones.